more referrals to kidney transplant centers. The reason why they're doing this is because people who get kidney transplants typically live longer than those that do dialysis. It's cheaper, less costly than say doing dialysis. It's a better outcome for the patient. The patient has their life back. When you actually see someone get a kidney transplant, it's remarkable. I consider it like the giving birth to children part of, kidney care. It's such a great sight to see when a patient actually starts to make urine. Now, the thing is, we need more adequate referrals, more often for referrals to transplant centers. Now, you would be surprised when you go to a dialysis unit how many patients haven't been referred or refused outright for some unknown reason. But they need to get that referral in as soon as possible. And anyone on dialysis technically qualifies, okay? Now, they do have to be a good candidate, okay? But oftentimes we want to make sure if they were disqualified, why they were disqualified. Are those disqualifications adjustable or reapproachable later on when, say, the person has a better condition? Now, the other component to this is what we call the preemptive transplant, okay? The preemptive transplant is not when someone's already on dialysis. It's before they even get on, okay? So this is when you as a doctor, nephrologist, you're actively involved. You look at the kidney function, it goes, as soon as it hits 20%, you're like, hey, I need to make this referral for a kidney transplant evaluation, okay? The reason why is typically dialysis is initiated around 15% or less, sometimes, sometimes a lot less, but around 15% is where the general consensus is. But if you get that person in early, instead of, and they get on the waiting list early, or if they have a living donor, they have an actual living donor that will donate that kidney, they can actually beat dialysis, meaning they can get the kidney transplant ahead of time without ever requiring dialysis. And this is one of the biggest goals of CMS right now, is to get those preemptive transplants in order and get these patients never seeing dialysis.